Hi everyone, welcome to my show. This is NainaMD, Beverly Hills, Fusion of Science and Beauty, where I'm looking to promote anti-aging regenerative medicine. And we've got a fabulous guest, Dr. Elliott Lander, and he is going to tell us about the latest, greatest in regenerative medicine. You've been a urologist for almost 20 years.
Yes, been board certified urologist, 25
absolutely.
years.
And tell me what got you interested in stem cells. And give me your story, because it's an amazing network that the surgeons have formed here in Beverly Hills and worldwide. It started right here. Please tell us a little bit about what you've been involved in.
Thanks, Naina. Dr. Berman, my partner, brought this technology back from Asia in 2010, and it was just a very simple way of obtaining high numbers of stem cells from your fat.
And that's so important, is to obtain the highest number that you possibly can, right?
Right.
Yeah.
It turns out that our fat is full of stem cells.
Yeah.
These are repair cells. They have regenerative and repair capacities. And if you just turn them loose and free them up from the collagen fabric that holds them in our fat, then you can use them for repair work. And they can do everything from age mitigation strategies to repairing cardiac disease, lung disease, arthritis. We've treated now over 2,000 patients for osteoarthritis, hips, knees.
So tell the technology. So it started in Asia. And he brought the technology in 2000 and when was that?
2010.
So 5 years, 2010.
5 years ago.
5 years ago, okay.
Mark brought it here and we started putting together our program, which was basically investigational study of stem cells from your own body, from your own fat, used on the same day.
Isn't that so that you're compliant with everything, plus the fact that it's your own body.
Your own DNA, no risk of transmission of disease from other people or other sources. So it's it's using your own body to heal itself.
And it's processed within the same few hours, so you can just utilize that. That's fabulous.
It takes about 3 hours to do a procedure.
Yep.
What we do is we do a mini liposuction, and we take.
So what's that? So just explain to the audience. A mini liposuction is like you go in with what is it? A syringe, a big syringe.
It's like a little cannula tip. It's a little skinny tip. What we do is we numb up a small area of skin, and under local anesthetic, we make a tiny puncture.
Generally, what is it in the abdomen?
Usually around the love handles. We love love handles.
Well, nobody's going to complain about that.
Nobody
I wouldn't
misses
mind.
them.
Yeah, exactly.
So we usually go around behind a little bit, your flank area. We make a tiny puncture through the local anesthetic. We put a little local anesthetic in, and we make a puncture and suck out 2 ounces, about the size of 2 size D batteries.
Yeah.
And with that, we can make anywhere between 5 and 50 million stem cells, which can then be deployed in different parts of the body. And how we deploy them is really what the focus of our work has been over the last 5 years.
So what do you use? Okay, so give me some examples of people who would come to you that would be to say, wow, stem cells could really help in this case.
Great question. 80% of our patients are orthopedic, in other words, osteoarthritis. People have been told they have bone-on-bone, quote-unquote, and maybe they need a hip or shoulder or knee replacement. They're looking for alternatives and options, and they don't want to have metal put in their body. And
or metal, or let alone the steroids. These are all short fixes, right? So
metal's potentially longer than steroids, but there's other side effects, and of course you have to undergo surgery. So this isn't for everyone, but for a lot of patients who would be looking at a surgery, and some people are unable to have it, or they're unwilling, or they're scared, or they're a little older.
And a lot of the people that do go for the surgeries, that do get the metal, sometimes those have to have resurgery too, right? In about 10, yes. Sometimes I've seen that.
But we don't know really how long the stem cells will last. Approximately 80 to 85% of the patients respond. It appears it's durable because we're going on several years now, but it may be at some point that'll have to be repeated, and that's okay.
But that's okay. I mean, it's your own body. You didn't have to have surgery. You had a fairly simple procedure. And you get amazing results.
Right, and we've now created a program where you can put your own stem cells away. We call it Cells on Ice, which is basically you can take stem cells, use some for repair work, and then put some away and freeze them, just like we freeze babies' umbilical cord blood.
Yeah.
And then, for a rainy day, maybe you'll have a stroke or an accident, or we can even use them for age mitigation. We can make custom cosmetics. We can use them for cancer therapies. There's so many different things you can do with these cells. It's like this really valuable, resource, almost like a bioinsurance.
When did you start that?
We're starting that now, actually. Currently, this is our latest project. And then, and the other thing you asked me about where we're doing this, we have in 2012 we started teaching this to other doctors. So we selected and credentialed select physicians around the country and around the world, and we're actually now in, I think, 80 different centers around the country and around the world where they're using our technology to free up some of these cells and use them to fix things. But it's not just arthritis. We have a number of other diseases, so a lot of different things.
I know you do. Can you touch briefly, because it's something that people don't really understand, but is getting very prevalent, and you're a urologist as well, interstitial cystitis.
It's really a big deal. Most of the women will describe it as like a urinary tract infection that never went away.
Yes.
And there's some really complex issues. There's some
Can be very
autoimmune components.
painful, yeah.
It can create pelvic pain. There's cases where, you know, the suicide rate is higher. People have their bladders
Yes.
removed, and even when they remove their bladders, sometimes the pain still persists. So it's a very, very difficult disease. It's frustrating and difficult to treat. It was one of my interests because being a urologist for all these years, and then having access to the regenerative cells, it was on my short list. So, you know, beside the arthritis and the heart and lung disease, we are interested in IC.
So when you do treat with the stem cells, what kind of results have you had?
Okay, so right now, as of now, we've treated 44 patients with documented interstitial cystitis. We have an 84% positive response rate,
Oh my gosh.
which is encouraging because for IC, most things, or interstitial cystitis, most treatments are not really better than placebo, basically.
Absolutely.
So we're encouraged. We take a kind of a complex approach. We treat it systemically, regionally, and locally. And what I mean by that is we work, there's an immune component, so you have to work on the immune system. The stem cells from your fat can reboot your immune system, and we use them for autoimmune diseases.
Well, isn't stem cell, and you know autoimmune disease is getting so rampant, and you know I do, of course I help you with all your ancillary things like kind of saying, okay, let's optimize the stem cell environment and making sure that the nutrients, the hormones are all balanced. And what I find a lot in my women who come to see me for like the perimenopause and all of that, the immune system starts to decline. So isn't that interestingly how when the hormones decline, the immune system starts to be affected?
Absolutely.
So when we balance that and then we give them the stem cells that are just a rich environment, it's like a double whammy, and you get amazing results.
Yeah, you absolutely have to optimize the patient nutritionally, nitric oxide, all the hormones.
Right.
And then, you know, if you're going to tackle IC, interstitial cystitis, you have to be very aggressive. We use the systemic treatment, which is intravenous stem cells. We use a regional treatment, which is stem cells injected into the trigone, which is the nerve network of the bladder and the pelvic floor. And sometimes people have trigger points, which are little tender areas that can recapitulate symptoms. Those have to be treated. And then as far as topically, we have a proprietary installation that we use that helps calm the bladder down and helps prevent the bladder from being inflamed 24/7 and gives the bladder a chance to heal. It gives the stem cells a chance to work. So we use that together with the stem cell therapy. And you know, we're excited about some of the early. Now this is not a cure because, as you well know, IC is
there is no cure.
There's
for
no
that.
simple. You know,
there's
not a one
for that.
answer for it. Exactly.
Yeah. But the main thing is you want to improve the quality of life.
Well, I think we can.
These women, these women are in pain. These are, and so when I've seen that women, some of them who have received the stem cells, I mean, their quality of life is so significantly
Some are
improved.
narcotics, and we're seeing narcotic use go down.
Yeah,
so that's
good.
good.
That's huge. That's huge.
Yeah.
So what about for arthritis? When you is there anything different that you say that your technology is unique as compared to, let's say, brand X? Or out there, because I think that's very important. I really got very interested in that as well about your you know, the whole network that you're involved with.
Our technology is one of the few technologies that's entirely closed. So from the time we do the fat suction until we actually inject it back in the patient,
and I think that's
it doesn't
really,
touch the outside environment.
So that's really important for the consumer to know, because closed is the key.
It's
you
safe
don't
and sterile
want
that way.
Safe and sterile, exactly.
Yeah.
So there are so many places you could go around the world and do stem cells, but if you don't really pay attention to sterility issues, how safe, and a lot of times I see patients, they're handling stem cells and all of the bodily fluids, and it's all over the place. So it's so important. These are the small details that go missed. It's so important to be able to have and feel secure that you are involved in, you know, or going to a doctor that is very much aware of all of this and paying attention to that.
Right, we're
Rather
obsessed
than a
with
med spa
sterility.
approach.
It's essential. It's absolutely essential.
Yeah, you have
and then,
to be.
you know, we use a lot of specialists. For example, we're treating certain brain conditions. We have a prominent neurosurgeon we work with, and we're actually injecting the cells directly into the brain on some patients. And of course, your sterility has to be.
Dr. Mark Byrne was telling me that's fascinating.
That's an awesome program. So
really
you know,
good.
we're doing that, and then you know, we're continuing to understand how to use the cells. We're making new deployment protocols, which means learning ways of. For example, IC. It took us 3 years to figure out that you can't just shoot them into the bladder. You have to, you know, use them in the way I described. Yeah. So there's very interesting and important ways that we are understanding how to deploy.
Yeah. Out of curiosity, why would you, instead of just giving them locally, it would make common sense, just give them localized to the bladder? Why are you giving it systemically? Why do you feel that systemically adding that factor might really work with interstitial cystitis?
You know, when you talk to your IC patients, they'll really, explain to you that they feel a lot of other symptoms. Some of them have chronic fatigue. Some of them have skeletal pain, joint pain, pain in their pelvis, pain around their ovaries and uterus.
So by getting systemically, it's going other places, in other words.
Right. Systemic inflammation is up, and afferent pain fibers, the pain fibers are overstimulated and they're oversensitive. Those have to be addressed. And there's a recent study out of Korea that showed that the pain fibers get less sensitive after you give mesenchymal stem cells.
Oh my God.
So you have to address the whole body of the person and their immune system, of course, because there's an autoimmune component to the interstitial cystitis disease.
No, absolutely. Listen, where can my audience find you guys if they want to come to you or just even get a consult with you? What is your website? Okay,
so we do have a location here in Beverly Hills and one in Rancho Mirage.
I know Dr. Berman, you are just down the street from me.
He's your neighbor, yeah.
Yep.
Stemcellrevolution.com.
Yeah.
It's simple. Just go to stemcellrevolution.com.
I love that name, yeah.
Yeah, we trademarked the name back in 2010. We understood that this is going to really be important and it's going to take off. And you know, it's a different world than the stem cells you hear about that they're manufacturing in labs. Those are from an allogeneic source, which means not from your own body.
Exactly, they're not from your own body.
They're grown in a lab, and cells change when you grow them over multiple generations.
Absolutely.
And then they're put in a bottle and basically commercialized and monetized, you know, and this is a completely different concept. This is personalized medicine.
This is personalized medicine, absolutely. In sync with NainaMD's view and philosophy. Thank you, everyone. We'll be right back
with
my next guest.
Thanks,
Thank you so much, Dr. Landers.
Great. Okay.